let's quickly talk about the possible clinical presentations of fistula. All right, so if a patient actually presents to the hospital and they have fistula, what are the signs and symptoms, right? So anytime you're talking about clinical presentation, it's kind of like a combination of signs and symptoms, okay? So what are the things that you're able to look at and basically what suspect that, oh, this patient actually has a fistula, right? Even if they're complaining of some other things, okay? If you see some things, you should know that the patient actually has this fistula. So on that basis, let's keep it up. I would say the clinical presentations of fistula, and this is basically like the combination of what signs and symptoms of fistula. All right. So same thing as asking what are the symptoms of fistula, what are the signs of fistula. Okay. So fistulas can present with a range of clinical symptoms. Okay, and this include there could be unintentional passage of urine, stool, or gas through the vagina, and that's basically what incontinence could be. Incontinence, right? Okay. Then there could be abnormal connections between organs and body surfaces. So this can be seen when you do physical what examination, right? So you could see that what intestines could be communicating with the skin, right? Uh, the intestine could be communicating with the vagina. The bladder could be communicating with the vagina. The rectum could be communicating with the vagina. So many things, right? So there will be abnormal communications. Organs that are not known to be communicating with each other will be communicating with each other. And that's basically what a fistula means. A fistula is basically what? Abnormal communication between two epithelial surfaces. All right, so this follows that there will be pain or discomfort in the abdomen, pelvis, or perineum. All right, there could be foul smelling discharge or pus from the vagina or rectum. Okay, and not only from the vagina or rectum, if it is anything that has to do with the abdomen, okay, there'll still be what this pus discharge from the abdomen. Okay, so there could be bleeding or spotting from vagina or rectum, bleeding or spotting from the vagina or rectum. There could also be difficulty controlling bowel movements or urination. Okay, what are the symptoms? Okay, is this one is okay? This one is basically for the anal fistulas, right? So let me just make this clear. When you go online, um, anytime you search fistula, the most type you see is basically the anal type of fistula because these are the most studied ones, right? But there are different types of fistula. You need to know all of them. There could be constipation or obstipation. There could be abdominal distension or swelling. There could be fever and chills. There could be generalized weakness or malaise. There could be painful intercourse, right? That's if she tries to like have sex and there's an abnormal communication between the vagina and any part of the body. There could be what? Painful intercourse. That's what? Dyspareunia. Okay. Then there could be vaginal itching or burning, right? So you see, this one is signs and symptoms of vesicovaginal fistula, right? There's involuntary leakage of urine. They may pass small quantity of urine normally. Vaginal skin is excoriated, and there's what? Smell of urine. All right. So still moving on, we said that the 13th symptoms that there could be rectal pain or pressure. That's any fistula that has to do with what? The rectum. There could be discharges, there could be changes in bowel habits. That's any fistula that has to do with the abdomen, like enterocutaneous fistula, enteroatmospheric fistula, okay? And the patient might be having diarrhea or constipation, right? Then there could be abdominal tenderness or mass, all right? So now the clinical presentation of a fistula can vary depending on the location of the fistula, size and complexity of the fistula, as well as the individual's overall health. Okay, so now some fistulas may be asymptomatic, while others may cause significant discomfort and disruption to daily life. Okay, that's it about what the clinical presentations of fistula. That's basically what you're talking about, the symptoms and signs all together. I see, guys.